I would like to thank our, she isn't with me yet. I think she will be here in a second. Coventry University is going to be finalizing this, this morning session with her amazing cross-cultural work on how we have been coping with COVID-19, but with a slightly different focus, this time focusing on the social contact and adaptive ways of coping and the government response. So here you go, Valerie.
Cool. All right, let me bring up the presentation. Here we are. This is working? Yeah. Great. So I'll be talking about what factors make the psychological impact of lockdown worse and which alleviate the negative effects of lockdown. And so there's no need to take screenshots of anything of this presentation because I've uploaded it on our Open Science Framework. You'll see the link here, but it's also in all the slides. So you can find all of this stuff back. And then there you can also find the preprint and everything. So that should help with taking notes, right? So on March the 11th this year, the World Health Organization declared the outbreak of COVID-19 a pandemic. And suddenly, billions of people are faced with the potential physical threat of catching the virus, as well as the threat of on their lives and livelihoods, such as substantial financial consequences or job uncertainty. And this is the result of the lockdown measures that have been implemented throughout the world. And I should add here that I am fully in favor of lockdown measures. I am just talking about what psychological impact it has, and I wouldn't advocate to stop it, especially not in the UK. Right. So how does this combination of threat and lockdown measures impact mental health? And what factors exacerbate and which alleviates the impacts during the pandemic? That was our research question. And in order to address this question, we asked 8,229 participants worldwide to answer an online survey, which included measures of their lockdown situation, perceived personal threat, anxiety and depression, and a number of other psychological well-being questions. So our main, the most basic model that we had was this one. Basically, we said people who feel a personal threat, which we measured as through the question, how severe do you think the effects of COVID-19 and the pandemic will be on your life? We predicted that this feeling of threat would increase feelings of depression and anxiety. In turn, we hypothesized that feeling socially connected would alleviate this this negative effect of personal threat on depression. Actually, it's not negative, it's positive because it would increase it. Negative in the sense of negative effect, maybe. So personal threat, the effect of personal threat on anxiety, we said would probably be alleviated if you still felt in control. And so this was our basic model. And then in addition, in an extended model, we wanted to know which factors would make this worse. So things as feeling socially isolated or having a high perceived risk of contracting the virus. In addition, we measured what factors would alleviate these effects, such as feeling socially connected through frequently video chatting with your friends. Right, so this is a quick overview, descriptive statistics of the participants that we had. So there were 12 countries for which we had about 200 participants or more. There was you know, a 60 to 40% division female male, and we also had non-binary people. The age range was across the population, so from 18 to in the 70s, 80s, so that was really nice. Oh, sorry, forgot to mention, the survey ran in the beginning of the lockdowns worldwide, so from March 28th until April 24th. So I'll just jump straight in with our main outcome, which is anxiety and depression, which I've juxtaposed here. And as you can see, I put the range and the legend on the right-hand side. So normally the way this scale is used is that if it's under, this is a cumulative score, it goes from 0 to 21. If you score under 7, that's a non-case. If it's from 8 to 10, it's a mild or potential case, and above 11 on both anxiety or depression scores is a definite case of anxiety or depression. As you can see, the US is in between 9 and 10. It's for anxiety. These scores are very, very high. So a study by Dutch people of the general population in 1997 found that their averages were around the course of 3.9 to 5.1. And so everyone scores above this. So we see that the levels are definitely elevated. We don't have a pre-pandemic baseline because, didn't really see it coming. And last year, but other studies have shown, are in line with this, other COVID-19 studies. And so what is particularly interesting here is that Italy scores highest on depression, and UK, Brazil, and USA are doing poor on both both types of mental health, but in particular for anxiety. Right, so this is again our basic model, but tested statistically. So I'll just run you through it. So in the middle, you see perceived threat, and you see that this is significantly associated with higher depressive symptoms and higher anxiety symptoms. In addition, at the top, you can see social isolation increases both depressive symptoms and anxiety symptoms. Right at the bottom, sense of control. If you have a low sense of control, that predicts higher, if you have a high sense of control, you have lower depressive symptoms and lower anxiety symptoms. And then we have the two moderation analyses in there. So the moderation of social isolation on the effect of perceived threats on the depressive symptoms is significant, which means that that the effect of perceived threats on depression is made worse if you feel socially isolated. The moderation of sense of control was not significant of perceived threat on anxiety, and we are thinking this might be because people felt not very much in control across the board, which I'll show you now. So we asked participants whether they felt like the actor or the director in their lives, and whether they felt that the amount of control that they experienced in their life was lower or higher than they would want. These are from previous research that one of our co-authors has conducted on control. And so I'll just add this line here. You see that's almost zero. It's shifted a little bit. All the countries score lower than zero, which means that no country feels in control on average. The stripes that you see in these waves of the rich plot are actually the median, but they've been ordered by their average, which is why it doesn't quite stack up. So in Portugal, they don't feel in control either, but they are the most in control of all the countries. And the United Kingdom, United States, is scoring very low on how in control they feel. Then our other moderator, social isolation. We measured that with 4 questions from the social connectedness scale, a subscale of that, and found that it wasn't as bad, but again, the United States, United Kingdom scored the worst. So people there on average felt the most socially isolated. Right, so now this is our extended model, and so this is complicated, but I'm going to run you through it. Basically, we've taken our basic model and then said, okay, so what factors make this worse, which make it better, as mentioned before. So I'll run you through it. We'll start with the factors that make your mental health better, because that's the most fun. So social actions, yay, they decrease social isolation. That's great. Then if you have a sense of control, that decreases depressive and anxiety symptoms. So that's great. And then we go to the negative factors. As before, perceived threats still leads to high depressive and anxiety symptoms. As before, we would want this to still hold from the basic model to the extended model, so that's great. Furthermore, if you perceive to be at high risk, you or your close family and friends, of contracting the disease and a severe form of the illness, then that increases your perceived threat. And if there are a lot of local diagnoses, such as at your workplace, at your child's nursery, in your household, then that increases your perceived risk, unsurprisingly, really. Then social isolation is associated with higher levels of symptoms of anxiety and depression, again, as before. And this is exacerbated by days in isolation. So the longer you've been in isolation at home, the more socially isolated you feel. This is predicted, but glad that it came out as well. And again, the moderation comes out again of social isolation on the relationship between perceived threat and depressive symptoms. Right. Oh, and the entire model, I forgot to mention, has a good fit, which I've noted here below for people who do structural equation modeling. Right. So that was our extended model. And then we wanted to so our main idea was, so we wanted to understand better what was going on with sense of control. And basically, sense of control was one of our main variables of interest, because having a sense of control over one's environment is considered a fundamental motivation. If you have a perceived lack of control, that's directly associated with poor mental health outcomes. And we thought, if you are in lockdown, we don't really know what's going on because the virus is new, the disease is new. We are feeling such a strong loss of control that this must have a very strong effect on our mental health. And we did find that people on average feel not in control. There are two ways of achieving control or regaining control. And one is a type of personal control. That's when you try to influence the environment in response to your personal needs. And the other one's compensatory control. That's the ability to adapt oneself in response to the environment. So you accept the situation and try to deal with it. And the actions associated with these types of control that we measured are as follows. So we had primary control, so individual actions to try and reduce the risk of contracting the virus, such as washing your hands frequently, social distancing, as well as gathering information about the disease. We thought, because this is a new disease, people really rely on learning more about the disease and gaining information and so on. For compensatory control, we measured two kinds. One is adapting oneself to the situation, as mentioned. So you are coping as best as you can with the situation at hand. But the other one is also is a social form of control, which is trusting the experts, such as the government and scientists, to take effective action in order to control the pandemic. So we entered all of these variables into a regression to predict sense of control. We follow that up by also trying to use the same variables to predict directly predict whether it would reduce anxiety, because as you can see at the bottom, the fit for a sense of control was quite low. No, it's not low, but it was lower than expected. And also one of our pre-registered models, because everything here was pre-registered, did not come out. And we think, again, it's just because control currently is it's hard to modulate. It's hard to regain a sense of control during lockdown, even with the traditional methods of actions of doing so. All right, so we ran this regression on both on control and anxiety, as just explained, with the control mechanisms that I just explained. And we found the following, which is that feeling informed, which we thought was going to be very important, was a significant predictor of having a sense of control, but it did not reduce anxiety significantly. So what you're looking at here, sorry, I should explain this. These are regression coefficients with confidence intervals, the two little branches. So this is regression, and I've basically, instead of having a table with lots of numbers, I've made a figure of it. And if the confidence intervals cross the dotted line, which is the 0 line, that means they are not significant. That's a whole statistical discussion, but take it from me. And it's also, the tables are in the preprint, so you can check it. Then we had entered frequency of COVID-19 communication with close others, because we thought, oh, that's a type of, a way of gaining information. But actually what this shows is that people are very anxious about COVID-19. And if you frequently talk about it with others, it's not so much about information. It's more an outcome of the anxiety rather than it helping anxiety. Avoidance actions, this was what I said, like washing hands and so on, did not give a sense of control, and actually was associated with higher levels of anxiety, which so we looked into this further, and I'll show that later. Then we had adaptive and maladaptive coping, Adaptive coding is good. Maladaptive coding is really not good, gives you low sense of control and a high anxiety. And then we had the government actions and institutional trust. So how much the government took action to control the outbreak and how much you trust the government. And these were significant for the anxiety regression, but not for the control regression. So from now on, I'll be looking into these three groups of factors, and I will in particular look at how they modulate anxiety rather than control. Right, so as mentioned, we had a whole list of avoidance behaviors that people could engage or could indicate they were engaged in. And rather than this showing that engaging in these behaviors leads to high anxiety, instead what we think has happened is that people who are high in anxiety already for other reasons, perhaps for perceiving a higher risk of contracting the disease, then engage in these behaviors. So it's the other way around. There was one exception, and that was the behavior of wearing an N95 mask, which is a high-grade medical mask, and that was the only behavior that actually led to a reduction, a significant reduction in anxiety. And so then we looked further into this and wondered whether that to us shows that personal protective equipment is really important. So we looked at our essential workers in our sample, which was 11.5% of the sample, and we found that indeed the availability of PPE was significantly correlated with lower levels of anxiety and depression, but it was a mixed bag. So in the sense that we got responses all over the scale, where -10 on the left means I did definitely not have sufficient access to PPE, whereas 10 means I definitely did. And as you can see, it's all over the place. And if we looked at individual countries, the responses were equally varied. And we think this is because our essential workers is a very broad spectrum. So that was everything from people who are bus drivers, supermarket workers, nurses, doctors. So we think that might be why the responses to this question have been so varied. Right, so on to the next prediction of anxiety, adaptive and maladaptive coding. For this, we also included in a regression depression or other outcome for mental health. And we found that accepting the situation leads to the highest reduction in anxiety and depression. Positive reframing, using humor and active coping also, whereas the others were more mixed, as you can see, and planning in particular actually led to higher levels of anxiety and depression. And we think that's because it's just really hard to plan right now. No one knows what's going on and what's happening next. Instrumental and emotional support is hard also, because instrumental support is getting help from people, like seeing them in person, getting, I don't know, things delivered or so on. And if everyone is strictly isolating, then that's just not available. In terms of maladaptive coping, we found that all forms of maladaptive coping were significantly associated with anxiety and depression, in particular self-blame, giving up, substance use, venting and denial. I was sad to read about the venting because I love venting about the situation, but there you go, I should watch out with that. Then finally, government action. So this had a significant impact on reducing anxiety. And when we looked at the individual government actions that we presented to the people, we found that ensuring that basic supplies are available led to the greatest reduction in anxiety, followed by telling people what is happening and why, explaining how long it will continue, and reinforcing a sense of togetherness. We gleaned these actions from a recent research paper on COVID-19, which had recommendations for governments. And so we've confirmed that these are indeed really important for the psychological well-being of people. Then we also looked at institutional trust. So how much do people trust in their governments? Since this was this also had a significant effect. And so institutional trust is measured with 3 different components, one being capability. So do you think that the government is capable of stopping a COVID-19 outbreak? Benevolence, is that action driven by sound values and principles? And integrity, do they actually try to counteract the COVID-19 outbreak? Oh, ambulance passing, how fitting. And so it becomes immediately obvious that if you look at Australia and New Zealand, or actually especially in New Zealand, people have high trust in both, in all 3 components, so capability, benevolence, and integrity. Then we look at Brazil and the United States, and it's the complete opposite. So people do not trust in the capability, benevolence, or integrity of their countries, of their government. Sorry. And I should have added that these are density plots, and the dotted lines are the averages for this country-specific averages. Countries like the United Kingdom and to some extent Italy are interesting because of the wide range of answers. So there is a lot of people have mixed ideas across the board. There's not one opinion in this country. Oh, I'm in the UK, that's why. It doesn't really surprise me, but that's a talk for another time. So here I've juxtaposed them again, and as you can see, they're all in the diagonal line, meaning it's highly correlated with R value on the right. And here it becomes very clear that Brazil and the USA score very low, and New Zealand scores very high, which is, what we've all seen in the news as well. Just for fun, this is for the USA only, because they also have state governments as opposed to the federal government, which is led by Trump. And across the board, people trust a lot more in the capability, benevolence, and integrity of their state government as opposed to their federal government. And yeah, that's just also not entirely unexpected. So in conclusion, lockdown has led to a mental health crisis, with certain countries particularly affected, such as the USA, Brazil, and the UK, and Italy in terms of depression. So some individual and social actions can make a difference in alleviating these ill consequences of lockdown. At the individual level, maintaining frequent social contact with close ones, engaging in adaptive coding, and avoiding maladaptive coding, such as venting, will help. At the social level, governments taking actions which show capability, benevolence, and integrity in managing a public health crisis and its consequences will also significantly alleviate the negative psychological impact of lockdown. In sum, together, citizens and governments can engage helpful actions to adapt better to restrictive measures during the current and future pandemics. Thank you very much.
Thank you very much, Valerie. I'll just check if anyone has posted any comments or questions. It was really interesting and amazing to see all the work that has gone into it. Again, I mean, I think this is going to be a common theme across all of our talks, but such amazing work that everybody has done in such short, tight time scales, often without funding devoted to this. I wanted to ask you one question about this distinction between depression and anxiety. It was interesting for me to see that emotional support seemed to solve our problems with depression more than it did with anxiety. Like, it wasn't helping anxiety so much, but we were feeling less depressed, it seems, if we have, or if we feel like we have social support. Do you think there could be a distinction made between depression and anxiety, in that there may be the two sides of the same coin, where depression is a bit more incapacitating response and anxiety is a bit more triggering response, and because it's more adaptive, perhaps it's not being alleviated by social support, because we still need to act or about, take precautions about the pandemic, and perhaps our anxiety is kind of triggering us to engage in that kind of action. What would your thoughts be on that?
Well, we predicted from the get-go that social actions and social isolation would be more strongly correlated with depression, simply because of previous research showing the importance of social connection and depression. Mm-hmm. I think we found a couple of counterintuitive results in our pre-registered models, which we then looked into further, and that's that we found that there was a social actions were actually associated with higher levels of anxiety, and we think there is something going on there with, if you talk a lot to other people, you might get a sense of togetherness, but you might also be talking about, you know, how everything's going wrong, you don't know what to do, and so maybe you sort of reinforce your anxiety in talking with others, which, you know, considering that venting, as I mentioned, is also negative, shows a negative effect. Maybe that has something to do with it. But yeah, not being able to take actions except for try and disinfect your home is, might be another one.
Yeah, really interesting. It was also very interesting, your point about the trust to the governments and how this influences people's well-being. Did you look into whether it was influencing people's behaviors as well, in terms of how they were engaging in those like preventive actions, hand washing and so on?
No, but we're actually planning another paper where we also look at conspiracy thinking. And so it looks like, and also patriotism. So if people trust in the government of their country and the people of their country, but not the people worldwide or the governments worldwide, then those people engage particularly in what I've called negative outgroup avoidance behaviors. So we had a couple that said, like I ran a factor analysis over the avoidance behaviors. And so they group together. So like self-care, disinfecting your home, washing your hands, but then, and then we had one that was distancing from others. And there was one negative outgroup behaviors, and that was avoiding foods that others have made, avoiding Asian foods, and one other one, which also was sort of, you know, not engaging necessarily in the most helpful of avoidance behaviors, but ones that sort of put some blame at others. So we are definitely going to look into that. And I wonder how that will pan out with trust in the government. Although we'd probably have to look within the country, right? Because there are very divided countries, such as, for example, the UK, where, you know, you might really trust the government or you might really not. And I imagine that will be different. But yeah, we'll definitely look into that next.
Well, I will be looking forward to that. And in the live stream, there's some comments for you that say that, well, you might want to check out Gerrit Fu and Hui Bai's talks, which will take place this afternoon. They say they have similar data about the conspiracy perspective and also trust in government and behavior.
Great.
So thank you very much. And on that note,